Our next speaker is Dr. Connie Henson, who is a psychologist and public health researcher, currently completing her PhD.
A second PhD.
Her second PhD, right? Just because she was looking for something to do. On the use of technology amongst older Aboriginal and Torres Strait Islander women to enhance community health. And so a great project. So over to you, Connie, to tell us all about it.
Thank you. Can you see my screen?
Yep. Oh, we can see you.
You can see.
Have you shared your screen
Not your
yet?
presentation yet.
How's that?
Yep.
Yep, it's all up.
Fantastic. Well, thank you for that lovely introduction, and thank you for inviting me to present my research today. I would like to start by saying I am speaking to you from the land of the Gadigal people of the Eora Nation, and I'd like to pay my respects to elders past, present, and emerging. These are the people who have looked after this beautiful country for more than 60,000 years. I'd also like to express my appreciation for all the Aboriginal and Torres Strait Islander people who are here today. Let's see if I can get this to move. I would like to also acknowledge the artist who created this beautiful piece of work, Kathleen Whiteman. You're going to see it throughout this presentation today, and actually throughout this entire research project. I am super excited about this research. I'm excited to talk with you about it today. I feel like it represents, this whole digital health represents a new way to address health disparities that are experienced by Aboriginal and Torres Strait Islanders. Now, I'm going to give you an overall picture. It's a research protocol I'll be talking about today. I'll give you an overall picture of what the research is about, but I'm going to focus mostly on the methods. And the reason is I mean, they're important for any kind of research, but I think, and it's been highlighted in this conference as well, that really special care needs to be given when the lead researcher is someone like myself who is not Aboriginal or Torres Strait Islander. I see myself as an ally. I feel privileged to work alongside Aboriginal and Torres Strait Islander researchers and community members to conduct this research. I absolutely believe, and I think it's been completely validated in the last day and a half, is that if we want to see positive change, then our methodologies must empower and prioritize Aboriginal and Torres Strait Islander perspectives. So let me just start with a little bit of background. There's 3 key data points that I think underlie the kind of why this research matters. The first is technology. Technology is absolutely revolutionizing health and medicine, but and there's incredible possibilities with that and very exciting, but we all know, we know about disinformation and misinformation, and we know that Aboriginal and Torres Strait Islanders experience racism online. And so we've got these potential harms there. Secondly, we know that Aboriginal and Torres Strait Islander people experience significant health disparities compared to other Australians. And unfortunately, as we've probably talked a bit about the last day, it's not changing as fast as we would like. But the good news, and again, this has been highlighted in the last day and a half, is this growing body of research that demonstrates the importance of culture and the positive influence that culture has on health and well-being for Aboriginal and Torres Strait Islanders. And that includes things like languages, the histories, the connection to country and connection to each other. Now, if I take these 3 streams of research and I pull them together, I think what they do is they highlight the need to incorporate culture, to build on community resources. And I really feel like they points to the criticality of centering Aboriginal and Torres Strait Islander perspectives from the inception all the way through to the implementation of digital health. Again, I think the shift to digital health, it provides us an opportunity to really proactively jump in there as health research is shifting. We can fundamentally change the approach to health research. So how do we want to do it in this particular study? Well, our overall objective is to privilege older Aboriginal and Torres Strait Islander women's cultural expertise to design and test a framework for developing culturally competent digital health programs. Now, I've broken this up into two different parts, and there's 4 aims underneath, but I'm going to stay at a high level today and talk about the 2 parts of the research. In part 1, we're going to delineate how social media is used, and we're going to develop a framework that's meant to guide culturally competent design, health tech design. And part 2 is where we'll test and we'll refine that framework. Now, I'll come back to this, but I want to move on to methods because, as I said, I think methods are absolutely essential. And many of you will know, although it's not evident at all that this has been true in the last day and a half, which is quite exciting, but historically, we have seen that health research methods have marginalized or even completely excluded Aboriginal and Torres Strait Islander ways of thinking, learning, and doing science. And quite frankly, it's just not working. So we have to change, as is really clear by the other presentations in the last day and a half. I want to talk about how we're going to do that in this particular study. And there's 2 components. One is Aboriginal and Torres Strait Islander governance, and the other is co-design, collective impact is the co-design we'll be using. So with regard to Aboriginal and Torres Strait Islander governance, I have 2 pillars. The first pillar is kind of the overall governance for the project. And because this is PhD research, the team that I'm working with is my supervisory committee, which includes Aboriginal elders and scholars. And I have an amazing committee. Let me just talk a little bit about these people because they're absolutely key to this research being successful. First, I'd like to talk about Honorary Associate Professor Bo Rambaldini, who's a Bundjalung elder and known to everyone in this group as a director of the Sydney Poche Centre. In addition to the scholarly input that Bo adds to this work, he also brings deep, rich cultural expertise, which he has absolutely continuously and generously shared to inform this research. Bo, I don't know if you're still on, but if you are, I just thank you so much for the input that you have given and continue to give to make this research really good and an amazing project to work on. A second person that's involved in this is Professor Bronwyn Carlson. She's head of the Department for Indigenous Studies at Macquarie University. And Bronwyn is an Aboriginal woman who was born and lives on Darwall country, and she brings cultural expertise from her lived experience. And she's also a scholar with an international reputation in the field of Indigenous studies. Thirdly, I am lucky enough to have an external Aboriginal supervisor. She's non-academic, and so she brings a really diverse perspective. Ms. Carol Vale is a Dungati woman. She's an entrepreneur and she runs a business advising leaders on the competent integration of culture into business and the built environment. So that's pillar number 1, and that's the overall governance for this research. Pillar number 2 is because I have a number of communities that are part, actually 3 communities that are going to be part of this research. And each community is a little bit different. And so we have an Aboriginal project governance group for each different community. And these will be headed by a woman who is a member of the community. She'll be paid for her time because she's actually going to be doing quite a lot. The goal and the purpose of the APGs is to provide governance for that community and to make sure that we are being sensitive and creating safety in that community, which may be different than other communities, because one size absolutely does not fit all, and we want to be very respectful of that diversity. Let me just talk a little bit about the co-design methodology. So we're using collective impact, which has been validated for use in or use with Aboriginal and Torres Strait Islanders for health research and for health program development. You'll see I've got the 5 elements. Many of you are familiar with this methodology. The key thing I'd like to say is that the five success elements are really about synthesizing diverse perspectives, which enable us to create a collective impact that's greater and better than what would be possible with different stakeholders working independently. At this point, I'd like to just take a moment and also talk about another member, actually the key member of my supervisory committee, which is Dr. Kylie Gwynn, who we heard from this morning. She is my thesis supervisor, and she's been instrumental in helping me learn how to practice allyship in a research context. So much of her work has been working with Aboriginal and Torres Strait Islander people to develop culturally safe and effective co-design research. So I'm absolutely thrilled to be able to learn from her as I am from my other committee members. I just have quite an amazing group of people that I get to work with, and that's pretty exciting for me. Let me just shift over and talk a little bit further about the methods and the process that we're using. I put together a couple of process maps, and I'm not going to go through all this detail. What I'd really like to point out here is we've got this iterative process. We've heard a few different presentations that have used yarning circles, a few different pieces of research. What we're doing here is we're using an iterative process so that we have yarning circles that are followed by data consolidation, and then that's fed back into the next yarning circle. And we continue that iterative process through this whole part one until we have agreement and we're able to create a framework that everybody thinks makes sense. So it's very much a building on iterative process. Once we have the framework in place, then we get to part two. Well, we use the framework and we basically to build 3 different case studies. And these will be social promotion case studies. One will be around breast screening, one will be around atrial fibrillation screening, and a third one will be around precision medicine. So related to projects that we've already heard about in the last few days. And again, we're using that same iterative design. I'm not going to talk any more about that because just for time, but happy to chat with people later about the process because it's actually pretty interesting and exciting. I'll just pull all this together now. You can see I've got the 2 main parts of the research there in the middle. I just want to highlight a tiny bit on the left-hand side. You can see big focus on community engagement and the forming of the APGs. We've talked a lot about that in the last few days, so I won't spend more time. I think people understand how important that is. But I will talk a little bit about this column on the right-hand side. And this is all about the dissemination of the information, the advocacy that comes from it. And I guess I'll just say what's really important to me, of course, publishing in peer-reviewed journals matters, but what I'm really, really interested in is creating accessible knowledge and information and tools that communities can use. And actually creating a sense of like how much fun science is for people. And that's what I'm really loving about my APGs and the co-design process. So look, in summary, I'm just going to say a huge thank you to the Poche Center and to all of my supervisors. I am absolutely thrilled to be working on this project. I think it's just health tech is so interesting to me, and it's the perfect way to reboot the way we do health research and to focus on strengths that are absolutely inherent in Aboriginal and Torres Strait Islander communities.